be talking with Arianna out of New York about what things they are doing to really impact recruiting and retention. And even though if you're not in the state of New York, I would tell you, listen to the podcast because they've got a lot of great initiatives, very, very creative that I think, if I listened to it, I'd be stealing some of this information because I think it's pretty good, or ideas, I should say.
Yeah,
But
they're
yeah,
doing a
yeah,
lot of great work up there. Cost of living and wages are top of mind right now for some of the association initiatives. And Ariana has such a great wealth of knowledge about some of their pilot programs and things they're doing to really bolster that workforce and make sure that we have enough people to serve the people in New York in the coming years. Up to their plan is up to 2032.
overall, great podcast. I was excited to listen to it and to hear their initiative. So, buckle in. I think it's going to be a great one. I think you can learn something from what they're doing, and hopefully, bring it over into your area and see if you can make some improvements with recruiting and retention. So, hope you enjoy the episode.
All
All
right.
right, we got a great show for you today. We're going to be talking about recruiting and retention with Arianna Stone of the Home Care Association of New York State. Now, New York's not like, I mean, it's just like every other state, right? They're facing a lot of many challenges out there, right? In terms of states and regions, with workforce shortage, along with the tug of war of how do you deliver exceptional care with all the cost in mind. And then, also with these challenges, though, I always tell people there's always opportunity, right? With every challenge, there's opportunity. And when you look at the stats, you got, 560,000 direct care workers and projections of significant growth in this industry. So we're kind of at a critical juncture here, right? So we're going to really explore workforce demographics, the economic challenges, and the innovation initiatives aimed at addressing these issues. So we're super excited to have you on here.
She is the Director of Research and Development at the Home Care Association of New York. She leads their program research, their data analysis, and their strategic initiatives. She also manages the association's grant efforts in identifying and applying to various grants that meet its membership's needs. So she brings such valuable experience in public health, home care and hospice, aging and long-term care, and evidence-based research in supporting the association's advocacy, education, and member services. She received her master's in public health from the University of Albany School of Public Health and her bachelor's in public health from the University of South Carolina Arnold School of Public Health. We are
So,
excited to have you here. Welcome, Ariana.
yeah, Ariana,
Thank
thanks
you
for
so
joining
much.
us. Sounds like you've been in school for 75 years.
It feels like that too.
You know, we love talking with associations because you guys do such a great job. We've got a lot of friends in different associations that, again, they're bad on the same things. And the exciting thing about our conversation is, hearing from you, especially in terms of the New York State, again, not that it's not different in other states, but, there are different challenges within New York. And, working through these complex waters of how we're going to shape what home care looks like, in the foreseeable future. But let's start off first with, because I always like to understand each association's like mission and scope and what drives them. So tell us a little bit about your guys' association.
Absolutely. So, the Home Care Association of New York State is our state's premier organization for advancing home and community based healthcare. Its mission is to promote and enhance the quality and accessibility of healthcare and support at home, reflects its commitment to improving the industry at large. HCA was established in 1978 and continues to play a pivotal role in shaping home care services. We're known for advocating for the sector at the state and federal level, providing comprehensive education programs, trainings, and conferencing, raising public awareness about the importance of home care and services through external affairs, and collaborating with policymakers, payers, and other healthcare sectors to address regulatory and operational challenges. HCA represents over 560,000 direct care workers in New York and nearly 300 member agencies encompassing certified home health agencies, licensed home care service agencies, hospice and palliative care, and health plans. Its advocacy efforts emphasizes home care's integral role in the broader healthcare delivery system.
Do you
And
like living in New York?
it's good. You get all the seasons, which I like. You get
Yeah.
a little winter, a little summer, spring, fall.
Yeah. But doesn't it take you like 9 hours to get just down the street?
You're thinking
Very
of New
big.
York City.
Well, I
There's
mean,
so much more to New York than New York City, the Big Apple.
I'm actually going to New York for the first time this year.
Oh, really?
Yeah, we're going to go in, I think, June or July, and we're going to see the 911 thing, which I think will be
Mm.
really cool, sad but cool. And then we're going to do some other things. So anyway, I've been to Buffalo. That's about my extent in New York, which people say that's not really New York. I don't know how Buffalo people feel about that, but anyhow,
Are you going to see
So
anything
I'm
on Broadway?
yeah, I might even do my own show. You know what I mean?
so
I don't know
I'm
what's coming.
Yeah, you never know.
I'm located right in the capital, so Albany. So that's about 5 hours. Buffalo's about 5 hours west to me, and New York City is about 3 hours south.
Got
So
it.
to give you a little
Do you go to
perspective there.
Buffalo or do you go to New York City? Do you go to the city much?
Go to the city a lot for sporting events, shopping, Christmas time, and then Buffalo. I actually went to Buffalo last year for a football game and a hockey game, and then we do have some big members out in Buffalo that we like to visit.
Got it. All right. I like Buffalo. I like the Buffalo fans. They're really good fans.
Arianna, what are some of the current demographics and the projected growth of New York's home care workforce? And specifically, how does that projected addition of nearly 200,000 new jobs by 2030, which is only 5 years away, how does that compare to other occupations within the state?
New York's home care workforce is on the trajectory of substantial growth, with nearly 200,000 new jobs projected by 2030. This expansion outpaces many other sectors due to the increasing demands from the aging population, higher prevalence of chronic illnesses, and shifts in care preferences towards home-based services. Home care leads as one of the fastest growing sectors in the healthcare field. As you mentioned, by 2032, an additional 861,000 direct care roles are projected nationally. The surge in demand reflects both the need for caregivers and the critical role they play in supporting the healthcare system by preventing those hospital readmissions and providing long-term care alternatives.
And so when you consider the median wage for home care workers, I think last I saw was like $17.52 per hour is earning about 25,000. When you think about those numbers, what's one of the most pressing economic and job quality challenges that these workers are facing?
Yeah, absolutely. Home care workers face a combination of economic and workplace challenges that hinder recruitment, retention, and job satisfaction. First, we have low wages and annual earnings. Despite home care workers' essential role, workers earn low wages, coupled by those rising living costs, making the profession financially unstable and challenging for many. But what is so unique about home care is that it truly takes a special person to provide quality care in the home. No matter the wage or earning, these home care workers are showing up daily, traveling to their patient's home and going above and beyond. For them, it's not about the price tag. It's caring for vulnerable individuals across the care continuum, from maternal and infant care to older adults, individuals with disabilities, those living with chronic illnesses, and patients with terminal conditions. Providing quality care and preserving individuals' dignity, independence, and quality of life. I think that's what really motivates the workforce to keep going. This is where the association comes in, really advocating for those fair wages and compensation for our workforce.
Yeah, Ariana, do you think I would be a better worker than Hannah in that field?
I'm not sure about that. Hannah did a pretty good intro of me, which you weren't too sure about.
Yeah,
I'm earning my keep over here. But I do think
I think I do better.
I think that you bring up such a good point. And we talk about people being mission driven and people being money driven. And you have this sect of people who, as these workers, right, they're very, very missional. But what we're seeing is such a discrepancy. And so for associations who are really pushing for fair wages, for wages that are more livable, because $25,000 a year is not a livable wage. It's not
Especially in
something
New
that's
York, right?
sustainable.
Now, maybe in Missouri, it's a little bit easier than what it may be in New York, but I would think in New
I
York,
mean,
that'd be
even in
very challenging.
Missouri,
Well, I'm
this
saying, yeah,
that's
but I mean,
and you're doing such an important job. And not that everybody's job doesn't have a purpose, but I mean, to caretake, to have the responsibility of human life in your hands to some degree, that is a weighty responsibility. And so to be earning such a low wage, I think we've just got to think a little bit bigger picture here. What specific strategies can agencies implement to improve recruitment and retention?
Yeah, so to address delays and denials in care due to labor shortages, agencies can implement strategies such as pipeline expansion. As an industry, we need more pathways for folks to enter the home care sector, building career pathways through mentorship, early student engagement, and partnerships with educational institutions, ensuring that there is a steady flow of new talent. We need more agencies collaborating with nursing schools to include home care clinical rotations and the importance and integral role nurses play in community health. Career advancement opportunities. We need to continue to invest in our current workforce and provide opportunities for professional growth and development. Agencies are increasingly offering incentives such as tuition reimbursement, paid training programs, and professional development opportunities. These efforts aim to retain workers by providing long-term career growth. Looking at recognition and rewards, going back to the basics here, to feel valued, appreciated, and supported in the workplace, agencies must invest in rewards and recognition opportunities. We have seen agencies provide employee rewards, whether that's a Daisy Award or an Employee of the Month recognition, an opportunity for monetary gifts, gift cards, and maybe even stipends. These rewards and recognitions can be small or large, like providing staff luncheons, but ultimately making those workers feel valued and motivated. And then lastly, working and focusing on workplace safety. Providing care in the home isn't always, the traditional way. You are often entering a patient's home environment alone. Oftentimes maybe leaving workers vulnerable with incidents and concerns about safety while delivering care in the field is on the rise. It reminds us how important it is to focus on prevention. Now more than ever, I think we need to ensure that staff are prepared and trained for any incidents that may occur during a home visit. Agencies should be focusing on, field safety and incident prevention to better equip workers to handle any risk during home visits, addressing concerns about personal safety, de-escalation, tips and strategies, and really how to safely leave a patient's home if needed. And I also think these trainings should have kind of like a role play component to really ensure that all the workers are ready and know how to act in the event of an emergency.
One of our earlier podcasts, we had an attorney on there and we are talking about workforce safety. And I was like, hey, what about tasers? Like, I think it'd be fun to tase somebody. If they get out of line, just tase them, watch them fall. Boom, done. All right, next patient. No, I'm just kidding. Now, while we were setting up this, podcast, there's one thing, or there's several things you've brought up that have been good, but you guys have a three-pronged workforce initiative that I think, as people are listening to the podcast, that even though we're talking specifically about New York, I think there's some great ideas that other associations can take from this, or agencies for that matter. The one that really caught my attention, I know there's three and I'll let you talk about those three, but the one that really caught my attention was this rotation pilot program. So as you're talking about these three, if you'd spend a little bit of time on that rotation pilot, that's something that's very interesting.
HCA has developed a comprehensive workforce initiative that has been funded by the Mother Cabrini Health Foundation. The first one I'll focus on is that Clinical Home Health RN Rotation Pilot Program. This initiative partners with BSN programs to integrate home care rotations into nursing education. Historically, home care has been underrepresented in the academic setting, limiting awareness and interest. By exposing students to this field during their training, the program seeks to create a pipeline of practice-ready nurses. Under this project, we have created an intro to home care video that is shown in the classroom to introduce BSN students to home care as a profession, show the different career opportunities available, highlight patient demographics and services. Another goal is to develop kind of a model blueprint for implementation by home healthcare agencies to increase their capacity to serve as a clinical rotation site for nursing students. Another area to look into is providing agencies a stipend to offset those training costs. Under the grant, we have done this, but for long-term sustainability here in New York, we have seen significant legislative development. The reintroduction of New York State Preceptor Stipend Program. This is a bill that proposes a $5,000 stipend for qualified preceptor clinicians. This program aims to incentivize experienced healthcare professionals to mentor emerging practitioners, strengthening the clinical workforce pipeline. So this legislative effort aligns directly with HCA strategies, particularly in expanding pipeline through mentorships and preceptor programs.
So it sounds like you spend a lot of time working with legislation, and I'm sure as registration transfers in and out, right? You got to re-educate them, but do you have to spend a lot of time really educating them on the challenges? Because I know surface level, if they're the 30,000-foot view, whatever, but then trying to get them to really truly understand not only the value. I think they understand the value, but I don't think they really understand the challenges. And then you got regulations upon regulations, and I think that affects what you guys can accomplish. Is the more regulations and stuff like that, it makes it a big challenge. So if you had to guess, how much time do you spend with legislation, trying to get them to understand the significance of this and the power and the blessing of what you guys are providing to people in your community?
We spend a lot of time educating the legislation, really, bringing it back to Home Care 101, providing them with the basics, and then giving them a strong overview of what providers are struggling with on a day-to-day.
So after we talked initially, Michael, Arianna sent me over the video because I really think this is a really cool thing that they're doing in order to raise awareness within the universities. So the local colleges, universities that have nursing programs, they're sending a video to these professors to show their students about the opportunity that they have within home health, because home health is not typically like a rotation that they would have or an awareness that they get. A lot of times they're thinking about going into ER or pediatrics or some of these that are, maybe more glamorous and sexy to go into as a nurse, but they don't get a lot of experience or exposure to what home health offers. And so this video is a really easy way. And then they follow it up with like, how much did you know about this? Kind of what else can we tell you? Where are some opportunities that you could get your foot in the door in home health? But I just thought, man, what a great idea. What a great way to get in the door of these universities, to connect with these professors. And then it segues into connecting with local home health agencies who can then take advantage of this $5,000 for their clinician stipend to take on some of these students.
So the second component is a home health transition to practice nurse residency pilot program. This is a competency-based residency program that helps new nursing graduates transition smoothly into home care roles. The program pairs novice nurses with preceptors, providing mentorship and skill development. Evaluations of this program will inform best practices for onboarding future nurses and addressing workforce shortages. The project will also conduct a final assessment and convene a roundtable of leaders from piloting agencies to distill lessons learned and develop a final blueprint. And then the third component is a home health recruitment and retention pilot program. This program conducts a comprehensive analysis of agency recruitment and retention practices, identifying agencies' gaps and implementing evidence-based interventions. It also provides technical support to agencies and gathers insights to develop a replicable model for sustainable workforce strategies. So really overall, these initiatives aim to enhance the visibility, support, and readiness of home care nurses, fostering long-term retention and improving patient care accessibility.
Well, Arianna, we appreciate you so much joining us today and give us some feedback on, what New York is doing. It's always great to hear from different states and how they're handling this. Just before we let you go, though, do you find associations calling each other and kind of saying, hey, what are you doing? What's working there? And because again, I know it's New York and And that's God's country. I've heard that, even though I think Missouri's God's country. But you guys share a lot of data back and forth of what's working and stuff like that?
Yes, absolutely. We love calling on our other state associations, hearing directly from them, their successes, their challenges. We are very collaborative.
Great. Well, thank you so much for being on. I mean, I'm
Yeah, thank
enlightened.
you.
Great to hear this information. I really hope that, we get a lot of support because we need great people coming from school into this field. It's a wonderful field. So I hope you guys continue to do well there and see some progress there. But thank you very much for joining us. We really appreciate you being on.
Thank you both for having me on the podcast. It is such a privilege to be a part of this conversation and to share my thoughts with your incredible audience on recruitment and retention